Okay, good afternoon semua. I am your trainer for today. I am Dr. Omien. I'm an occupational health doctor and also an ergonomic risk assessor for Max Clinic.
Turn on.
Okay, before we start our training today, saya akan ambil attendance dahulu. Syahira ada ke?
Ada doktor. Yes.
Alisha ada?
Saya ada.
Okay, Celeste is here?
Yes, I'm here.
All right. So next, before we start our training, I just want to go through our classroom. So first of all, please silence your phone during the training. Be on time for every training. Prepare your own stationaries. Be eager and ready to learn. You can ask me questions if there is a pause. And then also keep the training room clean. So sebelum kita start class, everyone, have you have your lunch just now?
Yes, we had the lunch.
So apa you makan?
Oh, makan nasi goreng.
I just
Yeah.
had my police just now.
All right. So semua sudah kenyang and then focus in the class, okay?
Okay.
Okay.
Okay. So now, today, our training is on 28th of November, and our timing of training is from 2 to 2:30, estimated of half an hour time. So first, before I start the training today, I would like to ask one opening questions. What hygiene or safety measures that made you feel a healthcare facility was clean and safe according to your previous experience? Anyone want to share? Yes, Malaysia.
Clean corridor and hand sanitizer always available.
Sure, correct. A clean corridor in any healthcare facility and hand sanitizer available always make you feel safe and clean. How about Shahira? Do you have anything to share?
Yes, I got. That is doctor always wash their hands before see the patients and also clean toilet.
Okay, correct. Let's say you see a facilities where the healthcare professionals always wash their hand, take care of the hygiene, definitely will make you more confidence to rely on them and also to take their service there in the facility. Okay, good. So good sharing from both of you. So next we are going to the topic for today. So our topic for the training today is the basic hygiene, health and safety practices in a healthcare facility. So, by the end of these sessions, you will be able to understand hygiene, health, and safety roles of healthcare workers in daily works. Number two, we were able to apply the best practice using the SOPs and PPE recommended. Number three, to react appropriately to the health risks and emergencies. And number four, maintain records for compliance. So for the part one, understanding hygiene, health, and safety roles of healthcare workers. They will break down into personal cleanliness of staff, clean and sanitized environment, waste management, and linen handling. So for the first part, for personal hygienes, the key practices are very simple actually. Number one, proper groomings. So like what you all mentioned just now, you prefers, professionals who having a proper own hygiene, short nails, clean uniforms, daily showers, no strong odors, hair tied to a back if you have a long hair, because it will make your outlook appearance to be more professional and more clean. And number three, that is the most important things, no jewelry or accessories in the clinical area. Why is it so? Because you want to prevent there's any incidents of foreign body left to the patients, injections, or any other things. Okay, so the next part regarding hand hygiene. It can be further break down into 5 moments of hand hygiene in healthcare settings. Number one is before patient contact. Before touching any patient, we should wash our hand. Number two, before clean and aseptic procedures. For example, blood takings or settings of granulas. So basically, you need to clean your hands before any clean or aseptic procedures to prevent cross-contaminations. And number three, it will be after body fluid exposure risk. For example, emptying a patient's urine from the urine bags or collecting sputums for the patients. And number four is after patient context. Even after a simple examination, you should perform hand hygiene. And the last one, which is always missed by most of the people, are after touching patient surroundings. For example, patient's beds, patient drip stands, patient's cardiac tables. All these moments actually you need to make your hand hygiene to prevent cross contaminations and bringing unnecessary germs to the another patients. Okay.
Okay.
Okay, so next we go for environmental hygiene. Besides personal hygiene, environmental hygiene is also very important in a healthcare facility. So for the basic cleaning principles, they always from clean to dirty area. That is to avoid cross contaminations. For examples, when cleaning a rooms, you will start cleaning from the high positions to the low positions, meaning you clean from the ceilings and down to the floor. And then work from clean to dirty. So basically, for examples, we will cleanse the general environments, for example, the doorknobs, and then the patient's tables, and then lastly, only the patients, because patients is the main source of the bacteria if there is. Another one is regarding the wiping methods. We always wipe in S shapes. That is to prevent cross contaminations from the top surface to the down surface. So this is what we shared just now regarding the area. For example, in a patient room, how are you going to clean? You clean from the common surface and the shared equipment. For example, toilets, floor, or the walls. After that, items that touch during the patient care. It will be the bed frames, it will be the drip stands, it will be the cardiac tables, and then lastly will be the patient's direct contacts. For example, their mattress and their pillowcase and all. So that is from shared equipments until to the patients, from clean to dirty. So next part about handling of clean linens. How are we going to handle the clean linens to prevent cross-contamination? First, perform a hand hygiene before handling. Number two, store in a clean, dry, and closed cupboards or shelf. Number three, do not place the clean liner on the floor or dirty areas and avoid touching your clothes when you are handling them. So how about soil or contaminated linen? Means those with use already contact with patients' blood or urine. First step, you should wear gloves and appropriate PPE for self-protections. Number two, hold the linen away from your body for self-protection as well. And number three, do not shake the linen because when you shake the linens, the airborne particles will transmit and it will go into the air. So number four, place directly into the designated linen bag or containers using the correct color coding. So for example of the color coding is the used or contaminated one, usually they are in red color codings. So you can see in the healthcare facility, we have white color linen bags and also red color linen bags. So white color is for general use, for example, patient clothes and all. But those contaminated with urines and bloods, it goes to the red color coding. So next, waste management. That is also an important part for our environmental hygiene. So know your waste bin today. We have three main types of waste bin in a healthcare facility. General waste bin for any types of waste, for example, papers, the syringe plastic bags. But clinical waste bins, it will go to gauze, which is contaminated with patient's blood, cotton balls, and then sharp bins is for any sharps, needles, ampules, and all. Okay, so next, we will go to how can we apply the best practice using the SOPs and PPE. The main aim is number one, to prevent the spread of infections. So types of PPE that is available in the healthcare facilities is commonly found, number one, glove. It is for hand protections from contact contaminations. Before you touching anything like content of patient risk for blood or urine or body fluid exposures, you should wear a glove. Number two, mask is to prevent inhalations of airborne particles. Number three, the gown or apron that we wear is for protection of the body and our uniform. And then lastly, the face shields or goggles, it is for eye or face protections. Uh, So the next part is how are we going to apply the best practice using the SOPs and PPE recommended. So the main purpose is to prevent the spread of infections. The types of PPE that is available in a healthcare facility that is easily found, number one, glove. Hand protection for contact contamination means whenever you're using glove, you can protect the germs contaminations from patients through your hands and then to your bodies. Number two, mask. It can be a facial mask, it can be a respirator, but the main purpose is to prevent inhalations of any airborne particles, for example, tuberculosis, and then influenza, or COVID infections that is able to transmit through the air. And number three is gown or apron. That is to protect your body and uniforms. And lastly, that is the face shields and goggles. That is to prevent for our eye and face protections from any splashes. So when do we need to wear that? For example, in the case of intubations for TB patients, then you need to wear that. Number two, when you're performing a swabbing test for influenza cases or COVID cases, then you need to wear that as well. So where to wear the PPE? Just like mentioned before earlier in the materials, when you are handling soil or infectious linen. Or number two, when there is a risk of splash or contact with body fluids. And number three, as per clinic infection control policy. So basically, that is the meaning. The main reasons for wearing PPE is to protect yourselves to become a transmitters after you handling a patient. So whenever you deal with patients, there is a risk for transmissions, then you need to wear the PPE. So this one are the parts of proper donning and doffing. How can we wear a PPE? And this you can see from here, donning of PPE means how the sequence of wearing the PPE. Number one, it will goes to gown. The inner area, you're wearing a gown or aprons. Number two, your mask to cover your face and your respiratory protections. Number three, it goes to your goggles for your eye and your face protections. And the last one, only the glove. But when you see that is a doffing of the PPE, means taking off. It goes upside down. You take off the dirtiest layer first, which is the glove. It goes to goggles, and then after that, only go to the gown and the mask. So always stay your mask to be the last one to prevent any airborne particles that possible for cross-contaminations during doffing of PPE. So how about disposal of used PPE? After doffing the PPE, you should dispose it in the clinical waste bin. Avoid touchings of the outer surface, means here. When it's contaminated outside, we should avoid touching it. So taking off the PPE, you should not touch the outer layer. And do not reuse the single-use PPE. So choosing the right PPE at the right time is the right way for your first line of defense. So the next part, we'll go to health practices in the support role. So meaning supportive staff in the healthcare facilities, how are we going to make the facility clean and safe? Everyone should help supporting the infection control as per clinic or hospital policy, where you need to maintain the clean, organized, and sanitized area, ensure proper cleaning of the equipment and the surfaces for disinfectants of the environments, follow SOPs for waste segregations and linen disposals. And then next, to ensure patient comfort and safety, observe for the risk for wet floor, sharp edges, loose cords, which might endanger our patients, customers, or even workers. And always observe the sign of distress, pain, or unusual behavior in the patients, and report the hazards or patient's concern promptly to your superior. How about first aid support readiness? We need to always identify symptoms and injuries where we need to attend the patients immediately. The common symptoms and injuries that we need to attend immediately, for example, are bleedings, cuts or injuries, sudden dizziness, fainting or collapse of patients, or patients having chest pains or shortness of breath, because they might just lost their consciousness in a while. That's why what immediate actions that you're able to give to the patients? Number one, stay calm, stay with the patients and provide help. And at the same time, inform the supervising nurse or doctors for help. And then next one, follow clinic SOP for emergency cases. And always remember to protect yourself before you help others. Use PPE whenever you are helping an injured patient, because we didn't know the patient's having what kind of germs, bacteria, or any infectious disease. And then the next part, react appropriately to help risks and emergencies. Maintaining safety environment is important as well, not only for infection controls. We need to always keep the floors clean, dry at all times. We do not want the patients who come to our facility to beg for help, but at the end got injured in our own facility. The caution sign of wet floors and biohazards when doing the cleanings and all is equally important. Next, ensure the medical equipment is properly stored and maintained. Do not block the walkways, exits, or fire extinguishers, because we never know when emergencies will happen. Always be ready. Emergency awareness. So to prepare for emergency awareness, emergency preparedness is something so important. Always know where is the clinic evacuation plan for fire and for flood. Familiarize yourself with the emergency exit routes. Participate in any fire drills or mock evacuations so that you know what to do when there is a disaster. And report any unsafe behavior, broken tools, or fire hazards. Unsafe behavior includes patients with distress. For example, patients with OPU patients, but they couldn't control themselves for their behaviors. When they are acting weird, it might be dangerous to the customer. So you need to report and attend to them promptly. So stay ready, and because emergency can happen anytime. Next is about hazard identifications and reporting. So once we already identify the hazard, we should know what is the next step, what to report, and how to report. For example, spills on the floors or surface causing a wet floor, exposed wires or electrical faults, missing or unclear safety signage. These are all the points that we should report. And how can you report? Tell directly to your superior or the emergency response team. And always record any incidents inside the incident logbook or using the digital system according to clinic policy. So we are going to the last part, and it's about maintain records for compliance. So documentations and reportings are equally important, because anything that is not documented or reported is equally to not happens or not done. So maintaining of records, use daily hygiene and safety checklists that are provided from each clinics or health facilities. Number two, record on the PPE usage and stock levels to make sure stocks are always ready, restocks are always there. Report any near-miss incidents, for example, slips that's avoided and faulty equipment notice. Why is it a near-miss need to be reported? Near-miss is something that not happened, but it nearly happened. But we can prevent all these near-miss incidents to prevent a real incidents or injuries. They are actually the key point for us to learn and revise our SOPs and also the workflow. So reporting and audit readiness. Ensure all the forms are filled in accurately, timely, and accessible for inspections from time to time. So this is the example of hygiene and safety checklist. So you can see over here, we can check on the floors, conditions, the surface of the counter tables, the waiting area, is it clean or dirty? How about the toilet facilities and consultation rooms and treatment rooms, the clinics, and also the general infections control practice in the clinic and the safety and emergency readiness. So this kind of checklist can be a guide for you to know which part you need to check on.
Another busy day. Traffic as usual. Now look at that. He goes right past the hand gel. Doctor!
How's the light today?
I'm a lot of pain, Doc.
Still no better.
No.
All right, let's take a look here.
Not even in gloves? Oh, come on. That doesn't really happen, does it? If you could see what I see, MRSA, VRE, Pseudomonas, etc., etc.
Here, can you take
Your attending isn't wearing gloves, so you're not either, right? Wait, the hand gel.
What? Okay, yes.
Are those gram negatives or gram positives? Oh,
Hello, can I help you?
those microbes spread everywhere.
Yes, I am. Okay, I'll draw that blood right now.
MRSA, VRE, whatever. Good grief. Nurse, you didn't clean your hands either? Oh, man. He just had an operation, and you've put a big IV in his neck. It goes almost all the way to his heart. Please don't.
Okay, so now we are going to give out the information sheets, and you have 5 minutes to read and check.
Okay.
Okay, anyone with the problems missing page?
No.
Okay, then we'll go to the next part. So Q&A sessions. So anyone with questions would like to ask for this training?
Mm.
Okay, Marisha, please.
Doctor, when do we need to wear sterile gloves?
Okay, so glove that, like what Malaysia mentions, there is two types of glove actually in clinical area. We have sterile and non-sterile glove. So usually for the cleaning purpose and then for this disinfectant purpose, we usually use non-sterile glove. For sterile glove, the usage will be when we are doing sterile procedures with the patients. For example, taking a blood cultures, taking a sputum cultures, or doing some operations or procedures, then we need a sterile glove to minimize the possibilities of cross-contaminations. Okay,
Okay.
anyone else with questions? Yes, Shahira?
Doctor, my question is, how frequent do we need to clean the environment of patient?
Okay, good question, Shahira. So environment cleaning is how frequent? Let's say it is for the normal high touch or frequently touched area. For example, the doorknobs, the patient's tables, the cardiac tables for the consultations. Then it will be per patient's basis or 3 times in a day. But for example, in a case for like fans, ceilings, then it will be only by 2-week basis. And even for the curtains, we just only need to clean that 3 monthly, once every 3 monthly, or per request. Means when there is a contaminations directly to the patients or like patient's blood splash on the curtain, then yes, we need to change. Okay?
Okay, thank you.
Okay. Any more questions from you all?
No, Doctor.
All
No.
right. Okay. So now this is the time for me to ask questions. How many key moments are identified by the WHO for performing hand hygiene in a healthcare settings? Anyone want to try to answer?
Me.
Okay, Shahira, please.
Okay, the 5 moment of eye hygienic is before patient contact, before clean the satellite procedure, and after body fluid exposure, after patient contact, and last is after touching patient surroundings.
Okay, good. So it's absolutely correct. So like what Shahira mentions, there's always remember there's 5 moments for hand hygiene. Where there's a before patient's contact, before clean and aseptic procedures, after body fluids, after patient contacts, and the most frequently means the surrounding of the patients. Okay, good. So next sessions, we are going to give out the assignment sheets, and every student have 5 minutes to answer. Okay, 5 minutes has passed, and everyone please send back the assignment sheet that you have answers. Okay, so today we have coming to the end of the lessons, and to summarize out what have you learned for the training today. First, you have understand the hygiene, health, and safety roles of the healthcare workers in daily works. Number two, how to apply on the best practice using the SOPs and PPEs, react appropriately to the health risks and emergency, and lastly, maintaining records for compliance. So our next lesson or the next trainings will be on healthcare cleansing services, and the date will be falls on 12 December 2025, and the timing of 11 a.m. to 11:30 a.m. and the locations of Mass Clinic meeting rooms. Okay, so thank you for your attention today. Always remember, safety and cleanliness are not just the tasks, they are the habits that protect lives. So if there is no questions anymore from you all, then that is for our lessons. See you in the next class.
Bye. Thank you,
Bye-bye.
Doctor.
Thank you.